But I really feel that body banking is important for two different reasons. First of all, like I said before, the clay, I can subtract and then add to other areas. So I can give the patient more artistic, athletic results. Sculptor never just takes the clay and throws in the fat. But the other real reason is the second part of the equation, and that is we're starting to learn about really what happens to those fat cells post-operatively. And as I've been watching this and I've been learning about this, I've looked at a lot of patients that we call liposuction cripples. What are liposuction cripples? Those are gentlemen that have, or women, that they have too much time and too much money. So they spend a lot of their time at fancy restaurants and at fancy plastic surgeons all over Europe and all over South America. And when you see these patients come in for the men, they've had liposuction 4, 5, 6 different times, and they all look like they're members of the same family. All their backs are like a tiny little waist, and then their belly is out to here. Well, why is that? Because those doctors, 3 or 4 times, they keep on sucking the subcutaneous sets of fat underneath the skin out, right? They keep on sucking it out, and sucking it out, and sucking it out. But unless the patient after surgery either decreases the caloric intake or increases the caloric burn, guess what? The fat cells left behind will compensatorily enlarge. So all those patients, all those liposuction cripples, they're still skinny back here because those fat cells have been removed, but they're 9 months pregnant because the only cells left over are the visceral fat cells and they compensatorily enlarge. We have a name for that. That's called rebound fat, or a funny technical name called catch fat. Compensatory adipotrophic cellular hypertrophy, which means those cells in their belly compensatorily enlarge, and also other areas, inner outer thighs, other undesired areas. So this is a real philosophy, and it's a real scientific medical phenomenon, and that's why we've been able to use it. We've been taking a bad thing, a paradoxically bad thing, and we've grabbed it and we've used it for us. Now we have the power in our hands by using those fat cells and actually putting them into good places to get a better result.